Welcome back to season 3 of the Mind Soul Connection. My name is Jaime Blaustein. I'm your host. Really happy to be back in the studio, a new studio, and here with, of course, Ben Brafman, the Chief Clinical Officer of the Sylvia Brafman Mental Health Center. Ben, how are you doing?
Doing well. Thank you.
Yeah, it's a little cold here in South Florida, colder than it was last summer when we last wrapped up season 2. And we're joined by a very special guest today, Dr. Yazmine Marimon. She is a Miami-based psychotherapist and a licensed mental health counselor, specializing in a very interesting area: intimacy, relationships, sex. I guess is your primary focus.
My primary specialization, yes.
Yep, and of course, trauma and addiction as well.
Yes.
So it's so great to have you on. Thanks for joining.
Thank you for the invitation.
Yeah, welcome.
Yes, thank you. I'm very excited to be here and to share my knowledge with all of you.
Yeah, and I don't know if I should reveal this or not, but I guess now I have to because I just said that. But Dr. Yaz is my therapist, actually, and she has a really nice way of explaining things. And I've seen you do a fair amount of media and podcasts and stuff like that.
Yes.
So,
I'm very active in media, podcasts. I have a Spanish podcast that is running now. We are in the third episode. The name is Amar, which means to love. and we talk about mainly relationships, love, codependency, narcissism, and sex, of course, that we cannot miss that. And more things that are coming because we just started 3 weeks ago.
Amazing.
Yes.
Well, I want to take a deeper dive into that because I have no problems. So you're probably really bored when I come in to meet with you because you're like, this guy's just so well adjusted, no issues whatsoever.
The subject matter, is somewhat taboo, especially in treatment centers. A lot of times the therapists are afraid to talk about relationships and intimacy and then sex itself.
Mm-hmm.
And it's never discussed. And it's a major factor in somebody's well-being.
Yes.
So having you here is, it's fantastic. We have a family program that the families would love to get knowledge of what you offer and what you can educate them about. And it does need to be spoken about more often.
Yes, and thank you for bringing that because the stigma doesn't allow people to get the treatment that they need. And sexual intimacy is so connected with addiction. There is so many angles that we need to treat when it comes to, and we are going to talk more in depth about it. But addiction as a process in general is a mechanism to avoid, right? To avoid feelings, to avoid hurting memories that can be very hurtful. And sex comes then into a form of behaviors. So sexual behaviors can become compulsive and be part of the process of the addiction. So that's one of the connections. There's other many connections, but that is really one of the connections.
Yeah, there's a lot of intersectionality, and I want to hear more about what drove your interest to focus on this particular niche. But maybe just start out and just tell us a little bit about yourself and your experience.
Yes. Well, I'm from Cuba, so I studied psychology there. And then I have been here in Florida 15 years. So I did my master's at Nova University. And I started my practicum in a mental health center that doesn't exist anymore. That was Bayview Mental Health. It was a mental health community. And that was my main clinical school, I can say. And my interest for sexuality started with, I remember very clearly, I had a 60-something years old lady, and I was treating her for depression. And one day she told me, I have been married for over 30 years, and I never have an orgasm. And I was like, okay, so what do I do with this? Right? I was in my practicum. It was during my master's, and I didn't have any idea of what to do with that. So I continued treating her depression. But then I coming from a culture, I'm a Latin culture. So in my country, we talk about sexuality. We are very open when we talk about sexuality. So coming from that culture and being in a different culture here, I decided to say, well, let me explore this field a bit more, especially because also I was exposed to a lot of sexual trauma in that mental health community. So I can say, and this is unfortunate, more than 90% of clients that I used to see there and that I also see now in my private practice, they have some source of sexual trauma, sexual molestation, sexual abuse. So that was my motivation to specialize as a sex therapist, and after I did a doctorate in clinical sexology. And then I always said, okay, there is two groups that I will never work with: children and couples. And here I am specialized with couples because then I was starting to see couples that were struggling with communication, with sexual intimacy, domestic violence. I said, okay, what do I do with this? And then entering into the fields of sexuality, I said, okay, I have to specialize also in relationships to connect both of them. And then I started also to specialize in couples. And I do a lot of complex couples. They only don't come with communication issues, but they come with addiction issues, intimacy, sexual dysfunctions, affairs. That's kind of the main problems for couples. And sometimes they are on the verge of the divorce, and then I make the intervention. Not always with happy end, but also it's useful for them to know how they want to go about it. And
sure.
That's
awesome. That was a really good comprehensive overview of kind of what you deal with, and I'm sure you could go deep in the weeds. And I'm really curious to see what is the overlap with your subject matter expertise and sort of your views on the best modalities and sort of the dynamics that exist in that niche and Ben's, because Ben, I would say if you had to pick one area that you really love and that you're an expert in, it would be the family dynamic. Would you agree with that?
Sure.
Yeah. I mean, we think here we call the family program our crown jewel. It's really the lifeblood of the Sylvia Brafman Mental Health Center. We like to say the family component is, or family involvement, I should say, is a non-negotiable for us. We're not the type of place where you drop your loved one off and you say, see you in 30 days or 90 days, whatever it may be. We demand that as long as they're 1% willing, as Ben likes to say, that they are involved. And we almost view them as being in a virtual wing of the Sylvia Brafman Mental Health Center. So obviously, you can apply intimacy to the family dynamic and family systems, a different type of intimacy, hopefully. And so there's probably some things in the sexual realm that wouldn't overlap, but I'm just curious to see kind of how these theories and ideologies kind of blend into one another. So, Dr. Yaz, what are the most common problems? You alluded to some of them, but what are the most common problems that you see with intimacy, relationships, and sex?
Yes, well, for a woman, it would be a low sexual desire. For men, would be erectile dysfunctions or premature ejaculation or sex addiction. And then with couples, would be lack of sexual intimacy as a whole. Like when couples comes with different sexual energies, for example, or when there is a mental health, an anxiety, an addiction, depression, PTSD, which is the post-traumatic stress disorder, that affects also intimacy. And that's another connection. There is an addiction in relationship that's going to affect the emotional and the sexual intimacy. There is two types of intimacy. There's more types of intimacy. We have the social intimacy, we have the intellectual intimacy, couples that they share these moments and they click, like they go to a museum together or they go to do physical activity together. So that's a moment of intimacy. When they kind of are in tune with the different types of intimacy, we can say, okay, this is a healthy couple. Sometimes we have couples that have a great emotional intimacy, but then because sex is used as a way to escape. Then there is the sexual disconnection, and then they lack the sexual intimacy.
Would that intimacy, the non-sexual intimacy that you referenced, be any different than me and my friend, my male friend, who there's no sexual attraction, going to a park?
Well, couples, they say we live like roommates. You know, that's the typical phrase. We are here because we live like roommates and I want to fix this. The fixers usually are the men that they want to fix. The woman in this case, sometimes they come with low sexual desire, or sometimes they think that the partner comes with a hyper sexual behaviors. Which sometimes is true. You know, it's just to understand what are the underlying issues in that dynamic. Because, of course, as you know, you can imagine, it's not about sex.
Sure.
Not always about sex.
Sure. What, Ben, I want to actually ask the same question, but with respect to the family dynamic. And I think just let me define family. I think we're talking a system of, you know, a parental, actually, I'll let you define it. When we're talking family systems, you're typically focused on the brothers, the sisters, the parents. Is that accurate?
And, you know, three generations. You know, I'm looking at the grandparents, parents, siblings. You know, typically, you know, accounting for the fact that we have blended families now and step children and all of that stuff. But that's, you know, generally speaking, that's what I'm talking
Sure.
about.
And what are you seeing as the big themes of, you know, thematically speaking, what are the categories that the major problems fall under that you see most commonly?
So, you know, there's a lot of similarities, but one of the biggest problems is lack of communication. There's also a lack of role identification. People don't really know what their role is. They may know who they are, but they don't know what to do. You know, what does it mean to be husband and wife, but also now that you have children, now as mother and father, and a lot of times that's never spoken about. And so you're just supposed to know, because that's sort of what society is portraying, whether it's in media or TV or whatever, and no one talks. And then, you know, you throw on there, as Dr. Yaz mentioned, you throw on their mental illness, you throw on their generational things that have happened before that are going to happen again. It complicates everything. One of the successes that I have in treating families is I go after the siblings and I build that relationship. Why do I do that? Because that's the most intimate relationship, is the sibling relationship. That if I can get siblings to be a united front and to realize that they're carrying the torch, they can make the changes. They not only can change the future, but in essence, change the past by helping the parents become who they are as well. And that's a lot of the magic that happens in family night and just in family in general, is because even if siblings are not there, I'm still discussing that with the families, and it tends to work. So there's a lack of intimacy, there's a lack of communication, there's expectations, all the things that I'm sure you're aware of. You know, people come in with expectations. You know, men come in with expectations, you know, in a relationship, and this is what I want, and you know, it's not met. And women come in with expectations, and this is what I want, it's not met. It's the same thing with families.
Yeah. And I think that what happens also in families and relationships is the dependency, right? The unhealthy.
I was going there. I thought you were going to say codependency first and foremost. I want you guys to dig into that, because I know that my mother, I mean, there's a whole support group for codependency, Al-Anon, Naranon. I dealt with that big time, or at least my mom did. My family did when I was struggling. And, you know, obviously we get better and the family tends to get better to some extent as well. But codependency, I know, is a theme that you guys both tackle often. And I'm curious to see what the differences are in a sort of romantic relationship versus
there's a lot of similarities. I mean, codependency is a debilitating disease. It's awful. You know, a person doesn't have their own identity. You know, a person is living for someone else, is doing for others. neglecting themselves. And it's the same thing in a relationship. I mean, you can touch on that, but that happens in the families, and it also is that's the beginning of addiction, right? And in mental illness is that, a kid realizes that, wow, I don't really have to take responsibility for anything. And so everything is about pleasure. There's no pain. And so it's just, I want more, 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 more. And eventually that leads to, drugs, alcohol, sex, whatever it is. And all because of the origins of this codependent enabling relationship.
Right. And has a lot to do with attachment, right? Like the way that you learn how to love in your family is the way that you're going to love as a couple in your relationship. That's why most people, when they come to see me or to look for help, they look for help because usually the problems shows up when they are in a relationship or when they are not in a relationship or they are missing the intimacy.
I want to ask a follow-up to that. I forgot where I saw this recently, but a lot of people say, I think out there in society, you can't love anyone until you love yourself. And I think there's probably some truth to that. Is there a healthy amount though of, and I actually think that me personally, like I'm a little bit too independent. Like there's gotta be a healthy amount of, I need this person, right?
Yeah.
To sort of like complete me. But like, is it an amount? Is it a type? Like, where do you draw the line between unhealthy codependency and a really, synergistic relationship?
Well, I put you an example. If you feel in pain, it hurt, sad, disappointment, whatever negative emotions you feel, I sit next to you. I sit next to your emotions, and I support you. But I don't try to fix you. I don't try to change the way that you feel. That's unhealthy dependency. And that's just one example. Boundaries. Like if I don't want, I don't like, I'm going to express it. I'm not going to say, okay, yes, whatever you want, because then you start to lose your own value, and that goes to your self-worth. That why you say, well, self-love for me is self-worth. Like what is the value that you are giving to yourself? And when you give that value to the other person, and let's say maybe that person really doesn't value as you deserve to be valued, that's it. You lose yourself in a relationship. So a healthy relationship is the one that has respect, but respect on the boundaries that you both agree on the relationship as a contract, as agreements, let's say.
And one of the reasons that's so difficult, whether it's couples or families, so codependency is so difficult because people feel like, especially parents, they feel like it's a reflection of themselves. Like if my kid fails, I'm a failure. And there's no line in the sand. There's no differentiation. And it's the same thing in a relationship that, the couples are like, if this person fails, then I'm a failure. And that's not true. That's the hook, that's the delusion. And you can be very addicted to that feeling too. I mean, it's a great feeling to like be a caretaker for somebody and see them, get better because you help them. Of course, that leads to, being a martyr and a victim and all that other crap that goes along with it.
And sometimes following what you're saying, you want to help the other person to relieve your own anxiety.
Yeah, it's selfish inherently. Like it doesn't feel that way, but I mean, I've seen people in relationships often, and it's less about, maybe on the surface, I'm coming with a bouquet of roses because I'm generous, but the real function that it's providing is it's prompting you to react a certain way towards me so that I feel a certain way.
But
it's fake. It's disingenuous and it's manipulative.
Yes.
And you're manipulating and you're controlling, which is at the heart of codependency, regardless of couples or families. But the control issues and dictating what happens is at the core of it.
Right. And it's not really love. Probably it's trauma, or probably it's a dysfunctional attachment growing up. Like avoidance of insecurity. That's when you feel the anxiety. And there's also emotional needs right? So you have the needs of validation, the needs of reassurance, the needs of feeling of being seen. Especially a validation is a huge one in relationships.
I want to touch on trauma, which you just mentioned, but before that, well, firstly, I want to just ask you. I'm gonna hold you to like one sentence each. How would you define intimacy? And I just want to say this moniker that I heard way back when was "into me you see."
Yes.
Right. So I guess it sort of speaks to a sense of vulnerability. But how would you define it?
Intimacy is like seeing yourself through your own eyes, kind of. And then if you are in front of a person and being able to mirror yourself when you are with that person. So that is really a strong connection and complicity. I think that complicity is a big word for me when you are in a relationship. Or, I'm talking about relationship, but also can be with friends or with your family, right? We're talking about family systems. So it's that sense of really being able to go into all the layers of the self, of yourself, all the layers of the psyche, and being able to be completely open and vulnerable, and to be able to share that. And if you have a reflection, you have somebody there that can see it and that can do the same, that's great. That is magic, really.
So intimacy, relationships, sex, three of the areas that you focus on, are they mutually exclusive? Meaning, could you have issues with just one of those? Or are they inherently tied?
But they're very interconnected. Let's going to use sexual intimacy in relationships. And then we have the three of them. Sexual intimacy is just one type of intimacy, right? And relationships, we can, not only couples, but all types of relationships. What I see most often, my specialization is sexual intimacy in relationships in couples. And then there is a variation of dynamics, like what we have talked about, addiction as an escape, addiction that affects communication and trust, and the dependency in relationships and in family. There is the sexual dysfunctions that also affects relationship, and also the emotional and sexual relationship in couples. And that is also, when you have a couple and they want to improve their sexual life, not only, sex is not only viewed as from a pathological perspective, but also you have couple that is, we want to improve it, we want to know ourselves better sexually. We want to be more intimate in this area, what we can do.
And then, do you think that these problems, whatever they may be, tend to be more environmentally driven or genetically driven? I'm just thinking of this as you're talking, right? Is it, it's sort of the nature nurture debate, right? And I would say that the nurture component, you could argue that trauma is a big driver of it. So when someone has some sort of dysfunction, whether it's sex, intimacy, relationships, whatever it may be, do you find more often it's like, hey, this is just the way that they're wired? Or do you find that, internally, so that would be the nature aspect? Or do you find that experiences and conditioning and trauma of some sorts are typically what drives those, call it, problematic features?
But I believe in the hardware, but I also believe strongly in the software. So yes, of course. You come with genetics. You come from a history in your family, generations of generation. We come from evolution. We cannot forget that biology. I believe that biology is stronger than psychology. And that's what I always said. Don't trust the addictive brain, because that is biology. So we never can trust that. So the connection between the biology, let's go to focus that into the addictive brain, for example, is how strong is our prefrontal lobe, that's the programming, right? All your beliefs, all your feelings, the meaning of your belief, the meaning of your thoughts, your experience, everything is all the learning. We're always learning. It's an ongoing process. And the brain changes as we learn and as we have experiences. That's why we talk about the plasticity of the brain, and that's what we can change, right? That's why people come to centers like this, and they stay 45 days. Ideally, for me, would be like 90 days, but I know, yes, for you too, 90 days. And 45 days where they say that's what the brain needs to create a new meaning, a new connection in the neurologically in your brain. So you create a new habit and you create a new behavior. So that's the experience, that's the new learning, and it is based on what you already bring there. So there is a predisposition, there is genetic predisposition to develop certain mental health conditions or addiction as well. But I mean, that's why we are therapists, and that's why we do what we do, right? We help people because we believe in transformation.
I want to ask the same question to both of you. Ben, if you could answer more in the family relationship space, and then maybe Doc. So what's a problem that you see that people may think is super unique to them, but in reality exists in a really large portion of the population? And either one of you can jump in on that.
So if I getting what you're saying, family comes in and they think that there's an issue and it's unique to them, but really it's really
and they may be hesitant to bring it up or to speak about it because they think they're so different, when in reality it exists in a way more prevalent way than they might suspect.
One of the things that comes up a lot is that there's a lot of shame in family dynamic and relationships, and families are hesitant to bring up. I'll bring up something that I'm sure that you can relate to, is affairs. That mom and dad, or husband and wife, or there's an affair, and the kids know about it. They know a lot more than the parents think that they know. And the parents come, or families come, and they think that it's some sort of big secret, and it's really not. And when that dam is broken, there's a lot of healing that can go on. There's a lot of understanding that can go on. Obviously, the kids' ages, but I think that's a spicy one, right? Because that happens a lot. And it's not talked about. It's brushed under the table. It's like, we're just going to move on. And later on in life, you have the kids who grow up to adults, and they're still pissed off at their, at their families. And the parents are sitting around going, why are you so mad? And it's because, there was no trust, there's just lies. So I think that's a big one,
Yes. And I think from a more global perspective, every person comes to look for help, and they think that they are the only one that presents that problem, a unique. And in fact, the first thing that we do in therapy is give permission. We give permission to the person to feel and to admit that this is happening to them, whatever it is, if it's depression, if it's anxiety, if it's symptoms of PTSD, addiction. So that's the first thing. And we normalize that feeling, in terms of, I see a lot of people with anxiety, I see a lot of people with depression, and there is a high percentage of the population that are experiencing what you are experiencing right now. So that's really the first step. So they can connect because they come with a sense of isolation and loneliness. Okay, so I'm the only one. No, you are not the only one. You belong to a community, and this community understands, hopefully, that what you're experiencing. So that's the permission that we give to them.
How common are affairs?
Very common. Very, 90%. I mean,
90?
High, very, very, very common. Especially because nowadays, you can define affairs as, okay, you're watching pornography in the room. Is that affair? You are sexting. Is that an affair? You are flirting. Is that an affair? Now there's so many definitions to affair. Before, it's just going outside of the marriage.
Sure. And that also speaks to what I said earlier, which is, you got to talk about that stuff. Is it okay to watch pornography? Is there an understanding between the couple? Maybe they never talked about it.
Yeah.
So therefore, there it is. That's a betrayal. So it's
anything
prevalent.
that is a secret in the relationship and creates a sense of betrayal in the partner, it can be an affair. Really.
Jamie, one of the things that makes family here at SB magical is, I like what you said, Dr. Yaz, the normalization of shame. I spend a lot of time on that with families and with the patients, getting the patients to talk to their loved ones, talk to their siblings, and talk to their mom and dad for the first time, maybe. And it's, to us, it's a normal conversation. To them, it's everything, because they thought that if they share how they feel about their dad, that I was upset with dad because of this or that or whatever, that he's going to yell at me or hit me or not speak to me. And the dads are on the screen crying because that's the first time that they heard their son or their daughter say something like that. And they're sharing that they're proud of them. And they're saying that for the first time. It's like shattering these stigmas. And it's just amazing to watch because it impacts every single person in that room.
Yeah, that's beautiful.
I want to ask a question that came up in another podcast. And I said, we were talking about various addictions. And is it are all addictions held equal in terms of potency? And how valid are they? And I said that at one point I thought that sex addiction was a cop-out. I think particularly during the Me Too movement, there were a lot of folks being put on blast for behavior and transgressions and certain conducts, and a lot were saying I'm a sex addict. And I just, as somebody who's been through addiction to substances, more like traditional addiction, I guess you could say, I just had a hard time buying that. And when I brought it up, and I think you said it is absolutely an addiction, and I think you said it could be maybe more debilitating in some ways than drug addiction. What's your view on that? Is it an addiction?
I do agree with that. It is an addiction, yes, because it's a behavioral addiction. Let's say it's not a substance, but affects your brain. It goes straight to the limbic system, to the reward system in the brain, liberates the dopamine, and you feel good. And that creates a cycle, and you have to withdraw. And maybe the withdrawal is not the physical symptoms that you see with alcohol or with a drug, but you see the depression, and you see anxiety, and you see the irritability, and you see the isolation and the disconnection from your partner. And that creates a fear, because if you go, like, a very common addictive behavior is go to look for massages with a happy end. Right, and every day you go, and then you get late work, which is one of the criteria for the addiction, the disruption in your daily life, in your level of functioning. Then there is a problem in your relationship, because now you're having an affair, and now you are betraying me because you're doing this. Or you spend hours and hours and hours watching pornography and causing yourself the self-pleasure, in which sometimes it's not really about sex. I mean, sometimes it's not really about sex. There is an emotion there. There is a need. I need the attention. I need to feel good. There is and if we go like another layer, we found trauma. And we found like the big disconnection with feelings, and then we have the ego, and then we have the personality and the grandiosity, and then when we have so many layers to this. So yes, there is a conditions, which is the sex addiction, that is real, and I think that I want people to really understand that if you suspect that you have a compulsive, like out of control, if you feel out of control with any behavior that is sexual, even flirting, you're flirting all the time, you cannot stop, and that brings that affects your functioning. That is you feel guilty. You feel guilty after that behavior. That's part of it. You create tolerance. That's another symptoms. With the time, you do more of that behavior to get the same rewards. We are in the presence of an addictive process.
I want to dig in a second into the trauma and specifically talk about EMDR, but I have to ask this for the millennials out there and Gen Z, I guess, and I guess you could argue pretty much every generation. The dating apps. Net benefit or net loss for society in terms of dating? I could think benefit, well, you have access to so many more people that you may connect with. I mean, I don't know the percentage, but I think it's like at least 50% now that meet their partners on a dating app. It's folks that you wouldn't have access to if it wasn't for this dating app, that you could end up being life partners on one hand. On the other hand, I know there's addiction with respect to that. I know there's infidelity that is driven by the access. I know there is this feeling and this sense of there must be something better out there. So it's a sort of calculus that involves a lot of pluses and minuses. What's your take on that?
Right, that's the problem with technology, that we're always thinking what's
It's
next.
at your fingertips, too.
Right, it's a fingertip, and it's the amount of stimulation of the brain that can change the brain. That's why I think that, yes, this combination between hardware and software, your brain is learning that maybe that's a belief. Maybe there is something else out there that can give me the same stimulation, a different stimulation. I don't know. I want to experience it. And that's addiction, right? What's next? Because it's never enough. And that's the core belief. And not enough is never enough. And that comes from childhood, right? That's what you learn from childhood. So I would say, yes, it has benefits. As you say, many couples, they found themselves but the main question for me is for what? When you go to a date app, just be mindful. Am I doing this because I want to find a life partner? Or am I doing this because I just want to have sex, one night stand? And again, that's okay. But just have to be mindful of how engaged you get into how you're connecting with different peoples.
Sure.
And do not ghost, because that's...
And I think as someone in recovery, like that's a principle that needs to be applied to everything, which is being honest with yourself on your motives.
Yes.
And it doesn't necessarily mean good or bad, but if we can't be honest about what our intentions are, then nothing else really matters after that.
Right. And as you recognize it, you can go through it, because it's part of the process of your recovery. You are now abstinent, sober, you're changing your lifestyle, because recovery, we know, is not only about being abstinent. And now you're also learning about your emotions. For me, that's the second stage in your recovery. You're learning to identify your emotions. You're learning, because for so long you have numbed your emotions, that now for the first time you're allowing yourself to feel it and to identify those emotions. So of course, now for the first time you're out there and you're trying to connect with people, and that's part of the experience as well. So you have to be compassionate with yourself and say, okay, maybe I'm not all out there like 100%. I'm not able, and maybe I'm having difficulties identifying what is this that I'm feeling, and that's okay. We work with that.
I want to talk about modalities for a second. So I know that one modality you focus on is EMDR. For those that don't know, eye movement desensitization reprocessing. So it's a modality that's often used for trauma. Can you maybe talk to me about what it is? And I know we do it here at the Sylvia Brafman Mental Health Center. What is it, and for what types of clients do you find it's most effective?
Well, it's a therapeutic approach that was developed by Francis Shapiro in the 1980s, and is believed to be based on how the brain works as an adaptive system. So your brain processes information. We're processing information all the time. So when the person experiences like an adversity or a traumatic event, significant event, that information gets stuck in your nervous system. And that creates the symptom. So what this approach does with bilateral stimulation, so we use the eye movement, and we use tapping, or we use sounds. So with the bilateral stimulation, those channels of memory opens up, and we can take that information, your brain takes that information and reprocess it in a way that you don't feel the negative emotions, or you don't have the negative beliefs that were originally created when that memory was processed in your brain. So it can flow, it can be adapted to the system. And there's different theories behind that. There is the theory of that our brain is an adaptive processing system, just like a computer. There is the theory of the working memory. So we have the working memory, we have the working memory, the short memory, and the long-term memory. The working memory is the one that does all the functions, like all the calculation. Like you go here, you go there. The short-term memory retain information for a short period of time, and then the long-term memory is where we recall those memories. So with the working memory and the bilateral stimulation, that's the one that opens up and activate the processing system in our brain and allow the information to be processed in a different way.
Is that your preferred modality in general?
Yeah,
and Ben, what about you? I know you're a huge advocate of CBT. Would you say that that's your preferred modality?
Yeah, yes. and also I'm a systems thinker. Family systems, but cognitive behavioral therapy. I'm very traditional. I'm not into like tricks or anything like that. Like it makes sense to me because I go after people's beliefs and their irrational thinking. And when I can get to that, I can open it up to other things. So
and I want to say that EMDR is not for everybody, no. And then the person needs to be screened. And the CBT, the EMDR, I use EMDR as a complement to CBT and other therapeutic modalities. It means not only one modality. It's very important that before you work with trauma, the person can have the resources to go into trauma.
Yeah.
No, that's important.
True. Yeah, I think that's at a high level our philosophy here at Sylvia Brafman is let's cast a very wide net and then hone in on the things that tend to be moving the needle, whether it's a modality, whether it's one of our 5 lanes, as we call it, clinical, medical, psychiatric, spiritual, vocational. Different things work for different people. So sometimes you need to just kind of throw it all against the wall and see what sticks. I want to wrap up with this question. So you focus on outpatient therapy. You've got your own practice in Miami. What are some of the indicators that you look for when determining if somebody needs to go to a higher level of care or a place like the Sylvia Brafman Mental Health Center?
Well, I look for the severity of the addiction. If the person is in high risk if stopping the substance or the behavior and they have a withdrawal and they need medical attention because they have a withdrawal. When the person has a history of relapses and is relapsing and the outpatient treatment is not working for them and they need more intensive treatment, that's another consideration for me. When the addiction affects severely the functioning of the person, meaning work, education, family relationships, that's another criteria. Safety, when the person is self-harm, is doing this behavior and is at risk to harm herself or others, that's another criteria for me. And also when the person doesn't have access to resources. They say that if the person doesn't have a family, doesn't have friends, is completely isolated, and doesn't have access to community resources. That would be another indication, or a combination of those that I just mentioned.
Sure. And the inverse of that, Ben, what do you look for to determine if somebody, let's say they start at either a residential level of care or in our PHP, partial hospitalization, let's say they eventually step down to IOP. What is the benchmark for they're ready to go on an outpatient basis?
Med compliant, that they can accomplish tasks or objectives or goals, that they can have a conversation with their peers or with their therapist and discuss progress instead of just the outcome and instead of just what do I get, their family interaction, are they communicating with their family and friends and or their children or their wives or husbands? I look to all of that, and then some of the basic nursing medical stuff is, are they sleeping 6 to 8 hours a day? I said taking their meds, brushing their teeth, showering. How are they dressing? Really participating in their own life. That's really the criteria.
And I think something that I love about this center is that you treat mental health and substance abuse. And that's another criteria as well for me to refer clients here. When you see somebody struggling with depression, severe depression, anxiety, or the trauma, and then they use the substance to deal with that. Sometimes you don't know which one comes first, but you're treating both at the same time. And that's...
Yeah, and I always say, like, addiction, substance use disorder was always closer to my heart than a primary mental health diagnosis, just driven by my own story and those that I feel I can help personally. But when I got together with Ben, we recognized there was a major need for a primary mental health treatment center that was really good at diagnosis, at treatment plans, and that could not take a cookie cutter approach that a lot of drug rehabs, really almost on every corner in South Florida, take with respect simply to addiction. So there's nobody that I would have preferred to do this with than Ben, really a genius at digging into the underlying causes of depression, anxiety, bipolar, personality disorders, really everything we treat here. So I'm really glad that we decided to go a bit broader with the scope of what we treat. And also really appreciate your perspectives on intimacy, sex, relationships. It's definitely a topic that I think there's more struggle around than people like to admit.
Yes.
Really amazing to have your perspectives on the podcast. And thank you so much for coming in.
Thank you. Thank you for the invitation.
Thank
it's
you
a
very
pleasure
much.
for me to be here.
Amazing. And
Thank
we
you.
will put the info for your practice in the caption of the description of this podcast. Dr. Yazmine Marimon, amazing therapist, amazing practice. And of course, if you would like to learn more about the Sylvia Brafman Mental Health Center, sylviabrafman.com. The Mind Soul Connection is our podcast. You can find it on Instagram. And really look forward to feedback on this episode. And we would love to know what you'd like to hear more of. So until next time, thank you guys very much.
Thank you.
All right.
Great.
Good stuff. All right.
Thank you.
Good deal.
First one in our new studio.
That's
Beautiful.
great.
Yes.